This is Chapter 1, Veterinary Pharmacology and the Veterinary Technician. So this is an introduction to understanding the therapeutic applications of drugs in pharmacology. So we start off with some key terminology here, starting off with what pharmacology is. And so pharmacology is actually the science and the study of drugs and how they behave in the body and how they interact with the body. When we start looking at using pharmacology to treat specific treatments or conditions, that's when we actually use the words clinical pharmacology. So that's actually using a drug to treat a specific disease or condition. And we can also use the term therapeutics for that. So once again, pharmacology is the study of how drugs behave in the body. And learning to apply pharmacology to specific treatments and conditions is what we know as the clinical side of the pharmacology there. And there's a lot of whys that we go into when we start looking at using the clinical pharmacology for the veterinary technician. So there's things like, why do we use this drug for a specific condition? Are we treating an infection? In that case, we're wanting to use something like an antibiotic. If we're trying to treat pain, we're wanting to use a drug like an NSAID. How does this drug work? What would be some of the side effects, or what we know as adverse drug reactions, and why do they occur? What should I look for in my patient and why? So if we have a patient, say, that's maybe on an anti-inflammatory drug, why would I be watching for GI upset like vomiting, diarrhea, or blood within the feces or within the vomitus? And the reason why is those drugs can actually affect the protection mechanism for the stomach and make it more easily to be upset and make it a lot more easy for it to have ulcers, and especially bleeding ulcers. We have 4 rules to live by for safe drug usage. So number 1, all drugs are poison. And so when we look at our drugs, they would all, depending on how we give them through the route of administration or the amount we're giving, all of them can become toxic and poisonous to the animal. We might have a medication that's perfectly fine oral, but if we injected it IV, it would become poisonous to the animal. And it can be the amount given. We might give something like a very small amount of a drug, say like an old treatment for heartworms was arsenic. Large amounts is very lethal, but small amounts actually treated the dog for heartworm disease. No drug is a silver bullet, so they're not magic. They're not going to get everything and cure everything. What they do is they actually change physiology. They're changing physiology within cells of the animal, or they're changing physiology within the cells, say like with an antibiotic of the bacteria. But they're changing physiology in somehow or another that the way that the cell works on the inside. And so there's not any drug that can miraculously cure and take care of everything through magic. It all has to do it through physiology. All doses are guesses. So dose ranges, we do have kind of a scientific backing. We've tried it in other animals. And if it's a labeled drug, which we'll get to in a minute what a labeled drug is, we have data that shows what the dosage range should be to be effective. Other drugs that we use extra label, we usually have some type of publication that goes on with stating what we have used that drug in an extra labeled dosage for. But we're looking at dosage ranges based on the masses, not the individual, and we go back to the whole part of physiology. Every animal's physiology can be different. It can be different on species, breed, gender, age. And so we're using a very good scientific guess when we're doing dosages, but it's still somewhat of a guess. And then lastly, complacency kills. We use a lot of the same routine drugs over and over again in practice. We get a much lower amount of vigilance with it. We get comfortable with them. Nothing ever happens until it does. So we never want to be complacent when we're looking at drugs, their side effects, what we're telling the owners to look for, what we're looking for ourselves. Key to remember is that drugs work by altering normal physiology. So every drug has a physiological effect on the body that can be beneficial, but it's also going to have physiological effects that could be detrimental to the patient too. An example is something like amoxicillin, which is a very beneficial antibiotic for taking care of infections. However, a side effect or a non-beneficial effect of it is it causes stomach upset and it can lead to vomiting and inappetence. So when we use a drug, we are trying to maximize its beneficial effects while trying to minimize those adverse drug reactions or those side effects that we do not want the animal to have because of their detriment to the patient. A big part of pharmacology is learning drug names and understanding that every drug has 3 different names. The first name is a chemical name, and so this is the name that lists out its chemical properties. And so this is something that a chemist could look at it and actually sit there and be able to draw out what all chemically this drug is made up of. So the very first one over here is a D alpha amino P hydroxyl benzyl penicillin trihydrate, also known as amoxicillin. So we have a non-proprietary name, also known as the generic name. So names like up here we have amoxicillin, ketamine hydrochloride, permethrin insecticide. These are all non-proprietary names or generic names. And then lastly, we have the proprietary or the trade name. And these are actually copyrighted. And you can tell because they have a little R with a circle at the end, meaning that they're a copyrighted proprietary name. If we're recording in a medical record, it is very important that we would know that, say for amoxicillin, if we're writing down amoxi drop, that we're actually using that and not something like Biomox instead. Because that would be very important for if we have an adverse reaction to know which manufacturer made it. So if we're not sure or there's not a trade name on it, we always use the non-proprietary or the generic name like amoxicillin. If we're using the trade name, we need to make sure that we are using, say, Biomox and not something like amoxi drops when we write that down. And we always try to put the R with a circle at the end of that. So we have generic equivalents, and so these are using the same ingredients from the label name or the label drug, so the one with the trade name with it, but we just have a different manufacturer than the brand name drug. We also have extracts, so extracts come from plant or animal tissues and are not from the laboratory or in synthetic means. Sometimes extracts end up being things like herbal, so different herbal things that we can get. Sometimes it's actually for things like a lot of times our natural-based insulin is actually from porcine or pork derivatives from the pancreas. And so that's actually, that form of insulin is actually an extract. Next we have legend versus over-the-counter. And so a legend drug requires a prescription from a licensed provider. That would be a veterinarian, physician, dentist, somebody like that, etc., that has got the legal ability to prescribe a drug. In veterinary medicine, that's going to be the veterinarian. In human medicine, we do have things like physicians, dentists, physician assistants, nurse practitioners, different people that can write a prescription. In veterinary medicine, to prescribe a legend drug requires a valid VCPR. That stands for veterinary client-patient relationship, meaning that myself as a veterinarian, that I must have a relationship with the client and I must have seen and treated that patient within the past year to have a valid veterinary client-patient relationship. Over-the-counter drugs are available without a prescription, and so these are drugs that you can go into a feed store, into a pet store, and get without having to have a prescription. This is only good for over-the-counter drugs for that specific species, and we'll get into that in a minute. Using a over-the-counter drug extra label actually requires a veterinarian's prescription. Very important when we're starting to look at things like vaccines, drugs, and pesticides is who regulates what. So the Food and Drug Administration, known as the FDA, is over top of, in veterinary medicine, all legend and over-the-counter drugs. So these are things that are anti-inflammatories, like these are things like Previcox or Carprofen, anesthetic agents like xylazine and ketamine, isoflurane gas, antibiotics, so amoxicillin, penicillin, gentamicin, hormone replacements, And things that are antiparasitics are different types of what people call dewormers, or properly known as anthelmintics. The EPA is over top of pesticides. So these are our topical flea and tick preventatives and treatments. So these are our shampoos, things like our Frontline that we place on the pet. These are actually regulated by the Environmental Protection Agency, or EPA. And then the United States Department of Agriculture regulates our biologic agents. So these are vaccines, plasma, bloods, and other biological products. Dose is the amount of drug that we will give at a single point in time. So the drug dose is when we're giving it at that one specific period in time. And dosage is the amount of drug that we administer per unit of body mass. So this is where we want to figure out how many milligrams of a drug that we're going to give per kilogram of body weight. Dosage forms, we have solid, and these are for oral. These are things like a tablet, a caplet, and a compressed tablet, which is also known as a chewable. So tablets are made to where we can actually easily split these apart. Caplets, also known as capsules, are not meant to be split apart. When we look at coatings on them, we have things like enteric coatings. So these are to protect them against the stomach. Sometimes we have enteric coatings to keep a certain drug from being dissolved in the stomach that needs to be dissolved and absorbed in the small intestine, because the stomach acid will cause that drug to be broken down and not be effective. Other times we use enteric coatings to actually protect the stomach on something, say like aspirin. A lot of our aspirin is enteric coated to where it goes to the small intestine. If it's released in the stomach, it causes a lot more issues for the stomach's lining and can cause stomach ulcers. We have controlled release, also known as sustained release or extended release, and so this is usually in a caplet or a capsule coating that causes a release of the drug over a period of time. There can be a difference between human drugs on controlled release and using that same human drug in a dog or a cat, as far as how much of the drug is actually going to be able to be absorbed by the animals, because it's made for the humans much longer GI tract, and a dog and cat have a much shorter, so they don't get necessarily as much drug. Or if we use that same drug in something like a horse, they could get more of the drug because of the relatively longer digestive tract. We do have gel caps, which have got the outer coating on them, and then they have actually got a liquid on the inside. And then something that we don't use in veterinary medicine, but it's available on the human side, is elogen. And so elogen is something that's actually meant to be held in the mouth and to slowly dissolve, usually used in response with things like coughs and sore throats. Liquids, these can be injected into the body, IV, IM, sub-Q, so in the vein, in the muscle, subcutaneous space. They can be oral, so we can give them by mouth. They can also be topical. When we have a solution, this is clear, you can usually see through it, and the drug is completely dissolved within. Suspensions are cloudy, and so the drug is actually suspended but not fully dissolved, and so a lot of times when we have suspensions, these are things we have to shake well to make sure that we mix the drug in there and that it will actually dissolve evenly across before we end up either injecting it or giving it orally. And then lastly, we have syrups, and syrups are for oral use, and they're drugs that are fully dissolved in a sugar solution. And so an example of a syrup would be something like Robitussin. Other drug forms that we use are going to be the semi-solids, and these are things like ointments, creams, and pastes that we can put topically on top of wounds. One thing to know is that sometimes when we look at some of these, especially like some of our syrups and suspensions from the human side, is to look and make sure that we don't have certain additives like something like xylitol, which would be very toxic to dogs and cats and would be lethal, and is something that they do use in humans to make something taste sweeter, let's say, but at the same time not have as many calories to it. So one place where we can find a lot of accurate drug information is going to be on the label. And so we have what we call label drugs and extra label drugs. And so a label drug, everything for that species is going to be listed on that drug label, and that drug is specifically listed for that species. Extra label is also known as off-label, and there's information of us using about what we're using that drug either for, or we're using that drug in say a species that's not listed on the label. So if we're using a dosage, a species or a treatment that is not listed on the label. That makes it extra label. An example of a drug label right here they're actually showing you is prednisone tablets. And this is actually a human drug, and if we're using this in an animal, this would be extra label. And the way I can tell that is it has this RX only, and we'll get into that in lab as far as what, when you see RX only, that being a human drug, whereas if it's a veterinary drug, it's going to say this drug is to be used only on the order or direction of a veterinarian. When we look at extra label use, there's a lot of human drugs that we use extra label in veterinary medicine, and a big reason for this is a lot of our drugs come from the human side originally, and drug companies do not always make them available in the veterinary form. And so we end up using these to treat conditions, just like we saw the prednisone on the previous slide there. We use a lot of prednisone in veterinary medicine as a very good SAID or steroidal anti-inflammatory drug. However, prednisone and prednisolone, both that we use a lot of, are not actually in the veterinary form, so we come and use those from the human side, and we're using those extra label because animals are not listed on that label. To use a drug extra label, you have to have a valid veterinary client-patient relationship, and it has to be prescribed by a veterinarian. There has to be no FDA-approved veterinary drugs available to use a drug extra label. Withdrawal times in food animals have to be supported with scientific data. We must be able to identify the animals treated. And in food animals and herds and stuff, that would be like having like herd numbers or some type of identifying number or tattoo, ear notch, something like that, to where we can go out there and identify all of those animals that were treated. If there is no safety data and we're using it in a food animal, we must ensure that that animal does not enter the food supply at all. So they must never go into the food production supply. We do have drugs that are banned for either for extra label use within food animals. And so we call this extra label drug use ELDU. And it actually comes from an act in 1994, which is the Animal Medicinal Drug Use Clarification Act. A place that you can go check for using different drugs in food animals, and if we actually have proper withdrawal times, and it will actually list current banned drugs, is going to be the Food Animal Resistance Avoidance Data Bank, also known as FARAD. And so you can go to www.farad.org, and if you go to that site, it will tell you about the proper dosage in food animals and whether or not a drug is banned. The following drugs are banned in food animals. So chloramphenicol, which is an antibiotic, clenbuterol, which is actually used for opening up the airways, diethylstrobismol, which is a form of estrogen, is banned. Fluoroquinolones, so these are going to be things like enrofloxacin, known as Baytril, but also ciprofloxacin, known as Cipro on the human side. Any extra label use of fluoroquinolones in any and all food animals is banned. The furozolodones are banned in food animal along with nitrofurazone, except in approved, for both of these approved topical applications where the animal is specifically listed on the label. Those are still allowable, but we cannot actually inject or put those two classes inside the animal, and if it is a topical, it has to be specifically have that food animal listed on the label. Phenylbutazone in dairy cattle older than 20 months or 20 months and older. And then extra label use of sulfonamides in lactating dairy cattle. We can use the approved sulfonamides in their approved dosage ranges, but we cannot use sulfonamides extra label in lactating dairy cattle. So a lot of times when we start looking at drugs, where do we go to actually get accurate information? So there is a limit on information that we can get that would be accurate for drugs. One place is always going to be the drug label. So if we actually have drugs that are actually going to be used in veterinary medicine, pretty much we're going to go to the drug label. For a lot of our human drugs in veterinary medicine, we rely on formularies. So we have Plums and Saunders are two big ones in textbooks, and you can also get an online version of Plums, and they pretty much list those two, all of your label and extra label drugs used within veterinary medicine. One that would be a specialized formulary for species that we have, that I have up here, is the Hagyard formulary, and that one is specifically for equine, and it lists things like, the usage and the dosage of certain drugs in horses. We can also do things like reading through different veterinary journals, trade publications, and proceedings from meetings to find where we've used a lot of different drugs and how to actually use them. And then we can also go to the internet, and there's good and bad with the internet. With the internet, I find it useful if I can find one of these trade proceedings or publications up here, or journals, to find something. There can be information from specific places like veterinary schools that I will use, and specific practices. However, there's a lot of places that we avoid, like Wikipedia and general Google searches and Bing searches and things like that. And we have to know that when we're using something off the internet, what actually makes it a good reference. And there's some different things that we can look at to figure out if it's a good reference. And so there should be things like a heading, whether or not they have a controlled substance or schedule designation. If they're listed in the United States Pharmacopoeia designation, USP, if it has both active versus inert ingredients in it, indications for uses, adverse drug reaction information, precautions, warnings, black box warnings, contraindications when we don't use it, and dosage and administration. And so we're looking for all of these things, and this is pretty much everything that's listed in the label. If you go read a drug label, you're going to find this information. And if we're wanting to use something on the internet, we should have this information also listed and available to us. Lastly, we get to our controlled substances. So these are actually controlled by the Drug Enforcement Agency. They are FDA approved drugs. However, the DEA regulates them because they have some amount of abuse potential. And this could be either abuse directly by a person as far as an addiction, or abuse by a person to, say, be used to control another person. We have a range of controlled substances, and we call it C1 through C5, and we use C-Roman numeral. The higher the Roman numeral, the less abusive they are. So a C1 is the most abusive potential, C5 is the least. All C1s are either illegal drugs, so they're going to be things like PCP or heroin, or we don't have any therapeutic use to them. Currently, by the DEA, marijuana is called a C1, which is somewhat different than what a lot of states are actually legislating on their own, which has led to a little bit of a conflict between the federal government and many state governments. C2 through C5, these have a therapeutic use. The veterinarian to prescribe these or to procure these have to have a federal DEA license. C2 are going to be your strong narcotics, things like morphine and fentanyl, and certain steroids, anabolic steroids such as Winstrol. These are going to be C2. C3 through C5 are generally not as addictive, and while there's still a controlled substance, we still have to log them, we still have to take all the same security precautions. They have a lesser amount of addiction to them, and so these could be things like Valium or diazepam or ketamine, certain other less strong narcotics like buprenorphine or butorphanol. So that is it for Chapter 1.